what is your assessment of the 11 months, even 1 year, we are fighting here for the COVID? What are your impression about this fight of the government?
First and foremost, let me start by saying this thing that COVID-19 pandemic has affected everyone on the earth in a way. Every person, every individual, every country. And Timor-Leste wasn't different either. So our lives have changed, and the country has, in terms of its capacity, has done extremely well. In terms of the, I would say, assessment, I could say that the government of Timor-Leste and the people of Timor-Leste have shown admirable resilience. They have been able to actually contain the transmission of virus by taking several important measures. On one side, when we were talking about controlling the points of entries, they took measures at that point of time. When we were looking into, see how do we do the early detection, how do we find the contacts. So based on to the WHO advice, the government and the Ministry of Health were able to put together those, the advices, the preventive measures. And not only that, it was very important for country to build the capacities for able to detect and test the COVID-19 virus in the country. The very first lab kits were actually provided and supported by WHO, but together with partners, I would say that the Ministry of Health has built that capacity. That's incredible to the part of the government that now we have testing capacity available. We needed to also quarantine people. We need to also isolate the cases once we detect them. And as a result, there was need for quarantine facilities, the isolation facility to be developed. So, across different pillars, as we call, be it the points of entry, be it the surveillance and contact tracing, be it the lab testing, be it the important aspect of risk communication and community engagement, to, even providing care those who need it, like any asymptomatic or mildly symptomatic COVID patients were really given care for. And, there has been what we call as a whole of government and whole of society response from Timor. And it was very interesting to know that on one side, the government, the people were dealing with the health response, but at the same time, it is very important to acknowledge the kind of support the government extended for non-health reasons like the cash transfers or the cesta basica, because people were in duress when we were into the time. And that shows, the resilience, that shows the openness of the government and people of Timor-Leste to be, kind of coming together and put a collective response. So in general, I could say that the government and the country has done exceedingly well in handling the COVID-19 pandemic, for sure.
Yeah, one thing was very impressive for me, because I live here for more than 8 years, and I know the week in this kind of we have a lot of problems, but it's very impressive because it's 11 months, even 1 year, and we resist. This is really incredible. And what was the organization, WTO participation during this pandemic?
WHO, as we say, as a lead technical agency and a very trusted and reliable partner to the government and people of Timor, we, from the very beginning, we started advising and advocating with the ministry to be able to well prepared because there were so many unknowns at the beginning when the pandemic started, or when, like WHO Director General way back in January declared the public health emergency of international concern. So one of the important things that WHO did was to bring on a regular basis, as the new information, new evidence kept coming, we started sharing it with the Ministry of Health. We started working closely with them to help them understand how the things are evolving and be prepared. It included on one side the technical advice, but also on the other side, like ministry's ability to put the systems in functionality. So like I said about quarantine and isolation on one side, but also very important, as you rightly said, the systems, even the strongest of the systems were challenged. Timor, one of the important things was to gain the trust of people. And for that matter, it was very important to continue to communicate with people, communicate the right messages and gain their trust. And that was one of the important pillars that we worked on, what we call as risk communication and community engagement. But also, I would want to again highlight that the way that WHO led, not only for supporting the Ministry of Health, but with the support of our all other UN partners, but also the donor community, which put that trust and provided us the due support, so that we can help the government with whether it is with regard to building the quarantining or isolation or equipping it. So as a whole, we were in a position to stand and be with the Ministry of Health and provide on one side evidence-based support, and on the other side help them build the capacity of the health system and the different structures.
And in all these efforts, the communication campaigns are important. What do you think about did WTO make some communication pieces for the internet or for publications, posters and etc.?
Well, actually, to be very honest, communication has been the backbone of our response. And WHO has been in the lead, and what we recognize, because, as I said, risk communication and community engagement is so very important, not only to convey the advices and preventive measures, but having that confidence and a trust between the people and what the government and the policy advisors are conveying. And importantly here, I wanted to underscore that from the very beginning, we also recognize it is just not a messaging in English, or it is just not messaging in using one platform. We were, getting them translated into Tetu, even, working on the 7 dialects that are there in the country and using all platforms. Social media, WHO has the highest following on the Facebook page in Timor, looking into the TV, the radio, the print media, developing number of kind of communication products to be able to reach to the masses, different audience, different target groups, so that, in a way, it's just again, I would like to say that the WHO providing that technical correctness, consistency and completeness on the messaging on one side, but adapting it to the local situation. And also an important aspect of this entire pandemic that every one of us know, that there have been a lot of misinformation, many a times rumors that have been coming in. We needed to manage that part as well, together with our sister agencies in UN, also our donor partners, and I would be, important for me to acknowledge the support that we got from the USAID, from the Australian DFAT, from the European Union, that allowed us to be able to develop a range of communication products that we could then deliver with Ministry of Health, and that is something which I would say played a very important role in the success in containing the chain of transmission of virus in Timor-Leste, actually.
Doctor, with the emergency and the emergence of contamination in communities like Covalima and Bobonaro, if that continues, in case of the contagion becomes of the community, what will be the measures? Are WTO response with this? We are thinking about this, but that's a possibility. We don't want this, but it is.
Yeah, no, you are right. We don't rule out any scenarios and any possibility, but let me be very clear and let me clarify one thing. What has been seen and has been found in Covalima is a result of the extensive surveillance. And what has been one of the strategy was the mass testing that was put up, and the number of cases that have been identified in a very border area, border village, the remote area, the Aldea, where the cases have been found. And they are, as we look at it, they are very confined to one village. And extensive contact tracing has been done. And to be very clear in terms of saying that we call them as cluster of cases, there is no further evidence as of now for any local transmission or a transmission, leave apart the community transmission, which is even further down in terms of the severity or the transmission levels that we call it. So please be clear that it is a cluster of cases. The contact tracing have resulted into finding the immediate contacts, and that particular village right now is in a way fenced in terms of what is called as a health or sanitary fence. That actually means that the movement is restricted while the people within there are living normally with their normal day-to-day routine. The idea is that when we find an index case and when we isolate these positive cases, all contacts are also traced. Those who are healthy quarantine, we do the test. Anybody testing positive, we isolate the case. We do further contact tracing. So that's the strategy that is recommended by WHO, and that is what we are working with the ministry. Also, ministry with the crisis group, which has been activated by the Honorable Prime Minister, the situation group. What has also been done is that in the border districts, they have put up a health sanitary fence until the 3rd of March so far, and they would review it further whether that needs to be continued. This is an important strategy because then the movement between inside and outside and out from their districts to outside is restricted. This allows the health ministry teams to do surveillance, to do contact tracing, to really look into where there is a chance of transmission. And I'm very happy to see the results of that effort, that even in Kovalima, other than that particular village, so far we have no other cases being reported. In Bobenaro, from even the mass testing, we have no results, which are no test which has been found positive. And same is the case for OQC, from mass testing that we are not having any positive cases. The important thing, again, I want to use the important role our media houses plays and our partners and collaborators play, because it's important to say that country has been able to detect any of the cases at a very early stage. Their quarantine strategy has been working very effectively. Yes. So what is happening? You quarantine a person for 14 days. On 10th day, 11th day, they test. If there is a positive case, they isolate. And if there is a quarantining, like generally there would not be any contact. So we are actually able to break the chain of transmission of virus. And that's why we continue to stand and support Ministry of Health on that strategy, because it's like kind of a no regret policy. People do talk about why 14 days, many countries have reduced it and all, but in Timor, it's working well. It is effective. And that's why it is very important for us to continue having this particular strategy and, focus on breaking the chain of transmission through the chain of the preventive measures that we are doing, because the strategy remains the same. Detection, looking into the testing, the contact tracing, quarantining, isolation, and care for those who need it. And Timor is doing reasonably well, I would say, in this field, actually.
I hope we have a future, a good future. I hope.
Well, I do say, God willing, that we all look to a good future, and we do look for, in terms of the way that the country has performed. As I said in the beginning, that even the countries apparently which have the strongest system were tested. They were challenged, and who hasn't been challenged during the COVID pandemic in a way. I also consider that the best room in the world is the room for improvement. We all are learning in this COVID pandemic times. As you said in the beginning, that the Timor system is relatively new, it's evolving, and it's suboptimal capacity. We do recognize that. There is acknowledgement of that, and that acknowledgement by the government, by the ministry, is also very important. And they have put in sincere effort, having done establishment of quarantine facilities, establishing the medical isolation facility, increasing their capacity for lab testing, transportation of patients, but also samples from different places, looking into points of entry, be it airport, be it the land, be it the seaport. All of that required multi-sectoral, interministerial support. And that's where I say the government has stepped up and has come forward and have coordinated and in a way like a well-oiled machinery. Within ministry, they have repurposed a lot of people as well, because number of actions needed to be done in terms of the whole incident management commandant structure that we put in place. The WHO, as the trusted partner, we have been helping them, working with them day in and day out, standing hand in hand with them. But as I said, best room in the world is room for improvement for our better and brighter future. One area of concern has been the capacity on clinical side, the critical care capacity. We are very, very fortunate that till date the system is not tested for a severe case, and God willing and touch wood that we don't have that situation. But to be honest, the country, the ministry recognizes that, and we are working to strengthen that capacity with the Ministry of Health on critical care. WHO, we will be bringing technical experts so that we can do trainings, because somewhat easier part is to get the equipment. We can get patient monitors, ultrasounds, the ventilators, the oxygen concentrators, but it's important to have skilled people to be able to operate them should that be needed. So in order to do that, because country has done and invested in building that infrastructure, in getting those equipment, we have trained several number of people already, and we would have 2 new experts on critical care so that we can build more capacity, we can have more trained and skilled people, not only in Delhi, but even in the regional referral hospitals as well, where we think the critical care capacity should be built further.
Yeah, that's my question. We have now, how many equipment? There's a lot of, and there are people also to, if in the, I don't want to think about that, but if they have a situation, a very bad situation, we have equipment now to,
yes,
to bring this. You have?
Absolutely. I mean, be assured the country is reasonably well equipped. When in terms of, if you ask me the numbers, I may be not absolutely spot with the numbers, but I could say I know for sure that there are more than 75 ventilators in a country. That's a large, huge number for a country of the size of Timor. There are hundreds of oxygen concentrators that are available in the country. There are a number of critical care equipment that is available, from what we call as the infusion pumps, when we call it as the patient monitors, sufficient stock of the personal protective equipment, PPEs as we call it, So I think in terms of adequacy of equipment and infrastructure, country has sufficiently availability of all of those things. As I said, that our concern, when I say suboptimal capacity, our concern is that do we have also enough number of trained, skilled people to be able to operate them. Having an equipment is one part, but able to operate is another part. And that's what the effort which is going on right now, so that we have sufficient number of skilled manpower also in the country. So be assured, I mean, touch wood, we don't need that, because I use catastrophe as opportunities. COVID-19 is a crisis, but through that crisis, if we are able to strengthen health system, why not? This critical care equipment, I mean, God willing, is not needed for COVID-19, but there could be a stroke patient tomorrow, there could be a emergency trauma patient tomorrow that might need similar, ventilatory support. So we have now the equipment, we have the skilled manpower. And as you said, bright future, I look to that the system would be strengthened further. And that's where partners are playing such an important role. I mean, be it the collaboration WHO is having with USAID or with the European delegation, which has given us substantive support across the response of COVID-19, or our collaboration with DFAT, which has provided us the support, plus the entire technical and financial support I get from my regional office, the Southeast Asia regional office, as well as my WHO headquarters, which have globally mobilized the financial resources, but also the technical resources. And we are in a, like kind of a 24/7 working pattern to provide the support to the country and the people of Timor-Leste.
Yeah, I think you want. You want. For you, it's good. Inimaginable, né? Inimaginable. And, what do you think, doctor? You have some parents in Brazil. You have some connections in Brazil. What do you think about a country who doesn't care for nothing? Because we have, unfortunately, we don't find any. The government doesn't find any recommendation of the World Health. What is there's a future of a country like this. It's a tragedy. Can you make only a commentary?
Well, actually, it is not correct for me to make a statement or a comment for a country which I know very little about. As I said, emotionally, of course, I remain connected. But I believe any country on the planet, on the earth, which is what we say, follow the WHO technical advice for the containment of the virus. And I believe even the government and the people of that country has been considerate. There may have been some challenges whether they were able to have the compliance to those practices or not is a different issue. But for example, I would say that our strategy hasn't changed. Strategy with regard to when we are talking about, early detection, to testing, to quarantining, to tracing, to medical care. And then we say, look at how you can prevent. So we said wear mask, particularly with the physical distancing is not possible. Avoid large crowd gatherings, for example. With regard to the hand washing. There is like simple measures which have been keeping the virus at bay. We also have been recommending people, for example, when we are in a avoid crowded, closed, confined places, have better ventilation. And I think many countries, including Timor, for example, have shown us successes through these measures, that these are successful measures in a way. So by discounting any one of these and to say that it is absolutely not needed, I think we are not doing the right thing. We need to put these public health measures to be followed by everyone. As we say that virus do not discriminate whom they are going to infect. So why should we be the ones, those who say that you do it and you don't do it? And I always say that viruses don't need visas. They can travel, they can transmit and anywhere. And because of the close proximity amongst the people, because of the gatherings, we need to then ensure that the mask is worn, hand washing is practiced, as much as possible the open ventilation is ensured, so that there is a mix of preventive measures and appeal by the policy makers for adherence to them. In the establishments like malls, in the shops, even if you go in Delhi, there is hand washing available. You go inside, they do not allow crowding at the cash counter. They will very politely request you to physically distance. And those simple measures, I believe, are the ones that could be way forward for any country, including Brazil, as you asked me specifically. And with the vaccine that has come up now, and we do see the hope at the end of the tunnel, I do see that increasingly the countries are gearing up and preparing themselves, including Timor and many countries, which we hope it is another tool in our armory now, in a weapon in our armory. This is not the only tool. People have to understand that as well. But we do hope, because the vaccine, the way that the efficacy is, that it is going to prevent and protect individual and large number of people from severe disease, from moderate and the mild disease as well. And I believe as the vaccine supply over a period of time improves in the world, it should be possible for us to have a greater coverage that will give, larger protection to the communities and people.
Yeah, talking about the vaccine, because I'm forgetting this. Talking about, yeah, the garden, swimming pool, it's there.
Oh, wow. That's like a palace for us. With a
Yeah.
garden and a swimming pool is like palace. So you are Emperor Claudio, right?
Yeah. Small house. Okay, doctor, let's talk about the vaccine. Why a country, that small country, it's only 1,300,000 people. Why not vaccine everybody as fast as you can?
Yeah, no, the vaccine, again, we need to go with science. We need to go with the evidence. We need to go with the technical evidence of first, whom do we need to vaccinate and what is the purpose of vaccination? The purpose of vaccination first is that we prevent what we call as disease and mortality. The second is that we need to understand that the severe mortality puts the maximum burden on the health system. So by protecting them, we will protect the economy and the social pressure on the system and on the people and the government. So that's the first purpose. That's why while we can talk about that, oh, everybody should get it, the purpose needs to be kept in mind, because that's the science-based, that's the evidence-based thing. So in order to do that, globally, our strategic advisory group of experts, which is an independent group on immunization, along with the WHO experts, we came up with like who should be the priority population. While we were doing this priority population, we also understand that look, it is unprecedented in the history of the immunology and vaccine development that a vaccine has been made available in 10 months' time. It used to take 10 years. So the production and availability of vaccine is also not like as we would want that, okay, all 7 billion on the planet can be vaccinated. So the supply would also be taken into consideration, and it is constrained. Having said that, as I said, that the first, let's go with the science. Whom do we need to protect the most? We need to protect the health and frontline workers. They are the ones, those who would, if they get, and they are encountering, there are so many losses in that workforce, which will put further pressure in a weak health system anywhere in the world. So we, as a technical group, advise the first 3% of the population should be your health and frontline workers. The second one, they say who are most at risk, the vulnerable population. That's elderly people, 60 plus years of people, those who need to be protected, because if they were getting COVID infection, the deaths and the complication were highest. So we said, okay, that is the second group that needs to be prioritized. The third group were people, particularly those who are above, like any age, but let's say about 40, about 30, those who have some diseases like high blood pressure, diabetes, or heart problem, or stroke, or are on cancer treatment, or somebody who has got like a replacement surgery or a transplant surgery. They are vulnerable, they are at risk. Disabled people, we needed to bring those in the first priority group, and that's what was agreed for, that this makes 20% of the population, and they should be our first target to anywhere in the world. And in order to bring the equity in the vaccine distribution, WHO came together with partners like Global Alliance for Vaccine Initiative, CEPI, and other partners, and we came together like Gates Foundation. We created a facility which is called COVAX, and this became a vaccine pillar of what WHO, along with the member countries, launched what is called ACT Accelerator, which is access to COVID tools, and accelerator became the framework. Access to COVID tools means not only vaccine, but also diagnostic, which was test, and also which is with regard to the therapeutics, the treatment. But the vaccine pillar, if I'm talking at this juncture, once we have reached to this, like advise that 20% is the first priority population that needs to be protected, COVAX provided us an opportunity that it will bring this amount of vaccine in a phased manner to all the countries which have signed on COVAX at no cost to the countries. So Timor is the same, where it's a signatory to COVAX, and the 20% of the vaccine Timor will receive through the COVAX facility in a phased manner. And we will be, phased manner means like 20% population of say 1.3 million, we're talking about 260,000 people. So the 260,000 doses needs to be made available to Timor, but they will be made available in installments as globally the vaccine gets available to COVAX. As the manufacturing capacity increases, we will start receiving. So that's why, number one, it is not correct for us to feel and say, oh, we should vaccinate everybody. The second thing over here, the science also is very important to remember. The vaccine that has come up so far, any type of vaccine, they are only tested and they are recommended for people above 18 years. So there is a large number of young people who are less than 18 years. So the vaccine is right now, the data is not available for us to say that we can vaccinate any young person less than 18 years of age. So that itself is a large group which will be out of the vaccination in any ways till, you know, like in the coming months, because it's so new, it is so evolving that new information comes, new data comes, there may be a recommendation, then we would see at that point of time. But till that time, we will be vaccinating the 20% as the priority population, and then we will be vaccinating the people between 18 years to 60 years per the availability of vaccine through the global market and scenarios.
But why Timor? Timor is very small. Why you don't vaccine everybody?
No, but that is again, I am saying that you're right. The emotion says that we should vaccinate everybody. The science doesn't say that. And also the point is that what are we, again going back to the purpose, the purpose is to first protect the vulnerable, prevent the severe disease, prevent the people from dying. So given that we have, even in Timor, there have been extensive discussions that we have had with the technical advisory group of immunization when we recommended the AstraZeneca vaccine, and have had, you know, series of discussions and consultations at the Council of Ministers meeting with the Honorable Prime Minister, with whom I have had a chance to have an audience and a meeting in this regard, the Vice Prime Minister who chairs the Interministerial Commission on COVID vaccine, which is an important development, the Minister of Health and the DG and the Ministry of Health team, together with WHO and UNICEF, we have been having extensive consultations on this and looking into even the epidemiology of the disease and looking at the success in containing the transmission. You know, like we needed to balance between the reality, which is where one side we know that vaccine is not manufactured in the capacity that we would want, so the supply chain constraints are there. Secondly, whether we really need to be panicking with regard to vaccinating the even 18 to 60 years, since we have been doing pretty well in containing the transmission and the disease is not severe and deaths haven't taken place, and touch wood, that Timor is one country which has no reported deaths. And given that all of these things, we were advised and we are advocating with the ministry to go with the science. And the science says first 20%, let's go in a phased manner. We are continuously preparing and working with the ministry and helping them to see how soon and when would they be in a position to get additional vaccine. Partners are playing very important roles. I mean, DFAT has committed, so are EU, which has made the largest commitment to COVAX, the USAID, which has come in, US joining the COVAX facility as well. So I would say that in totality, Japan has contributed, Korea has contributed, all of the partners are coming together to support the country and globally as well to WHO. But I will repeatedly, like a broken record, say and advocate that let's go with the science, let's protect our most vulnerable at-risk population, help us protect them, the health workers and the frontline workers who will then help protecting us should there be any mild case or a moderate case, they are the those who are going to provide us the care. So help us protect the veterans, the elderly people first. Help us protect the people who have some comorbidities or disease so that they are protected and they don't burden the system. And then we work together with you. And through you, I also appeal to people so that they can, support vaccinating the vulnerable population first and don't raise this expectation. That time will come and people would get vaccination. As we say, our principle is equity. We want to make sure the vaccine is equitable, available to people. But vulnerable population, people with the disability, people with the diseases, people with the elderly, those have to be first prioritized as 20%.
Thank you so much.
Absolutely a pleasure. Absolutely a pleasure.
Yeah, that's very good.
Yeah.
Yeah, we need to understand this because I live here.
Yes, we were celebrating the 25 years of their company. The Excellency, the Brazilian ambassador in India, was the guest of honor in the function that we were doing. So there is a connect with Brazil that I could share with you. And one of the directors of his company, Miss Fernanda, she is like a family member. She now even cooks Indian food.
So we have now the equipment, we have the skilled manpower. And as you said, bright future, I look to that the system would be strengthened further. And that's where partners are playing such an important role. I mean, be it the collaboration WHO is having with USAID or with the European delegation, which has given us substantive supply WHO headquarters, which have globally mobilized the financial resources, but also the technical resources. And we are in a, kind of a 24/7 working pattern to provide the support to the country and the people of Timor-Leste.
Sons?
I have two sons.
Yeah?
Yeah.
Where?
In India. My family is not here right now. My elder son is also in the School of Medicine. My wife is also a medical doctor.
Wow.
Yeah, so my son is in mine, which is Commerce and Accountancy.
Yeah, I have three sons.
Oh, is it right?
Yeah, they are all in Brazil now. I have a grandson now. Yeah.
You are a young grandfather.
Yeah, I'm a grandfather, yeah. I'm very happy.
Yes, of course. Brazil is very close to our heart. I tell you why. My younger sister and my brother-in-law, they have businesses in Brazil. In Porto Gallery, in Sao Paulo, and they are the ones, those who have big factories there. The Brazilian ambassador in India was a guest of honor in the function that we were doing. So there is a connect with Brazil that I could share with you, and one of the could be way forward for any country, including Brazil, as you asked me specifically. And with the vaccine that has come up now, but we do hope, because the vaccine, the way that the efficacy is, that it is going to prevent and protect individual and large number of people from severe disease, from moderate and the mild disease as well. And I believe as the vaccine supply over a period of time improves in the world, it should be possible for us to have a greater coverage that will, as we say, as a lead technical agency and a very trusted and reliable partner to the government and people of Timor. From the very beginning, we started advising and advocating with the ministry to be able to well prepared because there were so many unknowns at the beginning when the pandemic started, or when, like WHO Director General way back in January declared the public health emergency of international concern. So one of the important things that WHO did was to bring on a regular basis, as the new information, new evidence kept coming, we started sharing it with the Ministry of Health. We started working closely with them to help them understand how the things are evolving and be prepared. It included on one side the technical advice, but also on the other side, like ministry's ability to put the systems in functionality. And for that matter, it was very important to continue to communicate with people, communicate the right messages and gain their trust. And that was one of the important pillars that we worked on, what we call as risk communication and community engagement. But also, like I would want to again highlight that the way that WHO led not only for supporting the Ministry of Health, but with the support of our all other UN partners, but also the like donor community, which put that trust and provided us the due support, so that we can help the government with whether it is with regard to building the quarantining or isolation or equipping it. So as a whole, we were in a position to stand and be with the Ministry of Health and provide on one side evidence-based support, and on the other side help them build the capacity of the health system and the different structures.
And in all these efforts,
That confidence and a trust between the people and what the government and the policy advisors are conveying. And importantly here, I wanted to underscore that from the very beginning, we also recognize it is just not messaging in English, or it is just not messaging in using one platform. We were, like getting them translated into Tetum, even, working on the 7 dialects that are there in the country and using all platforms. Social media, WHO has the highest following on the Facebook page in Timor, like looking into the TV, the radio, the print media, developing number of kind of communication products, I would say played a very important role in the success in containing the chain of transmission of virus in Timor-Leste.
Doctor, with the emergency and the emergence of contamination in communities like Alvalima and Bobonaro, if that continues, in case of the contagion becomes to the community, what will be the measures? Are you response with this? We are thinking about this, but that's a possibility. We don't want this, but it is.
Yeah, no, you are right. We don't rule out any scenarios. Leave apart the community transmission, which is even further down in terms of the severity or the transmission levels that we call it. So please, that actually means that the movement is restricted while the people within there are living normally with their normal day-to-day routine. The idea is that when we find an index case and when we isolate these positive cases, all cases for OQC from mass testing, that we are not having any positive cases. The important thing, again, I want to use the important role our media houses plays and our partners and collaborators play, because it's important to say that country has been able to detect any of the cases at a very early stage. Their quarantine strategy has been working very effectively.
Yeah.
So what is happening? You quarantine a person for 14 days. On 10th day, 11th day, they test. If there is a positive case, they isolate. And if there is a quarantining, like generally there would not be any contact. So we are actually able to break the chain of transmission of virus. And that's why we continue to stand and support Ministry of Health on that strategy, because it's like kind of a no regret policy. People do talk about why 14 days, many countries have reduced it and all, but in Timor it's working well. The facility, increasing their capacity for lab testing, transportation of patients, but also samples from different places, looking into points of entry, be it airport, be it the land, be it the so we will be bringing technical experts so that we can do trainings, because somewhat easier part is to get the equipment. We can get patient monitors, ultrasounds, the ventilators, the oxygen concentrators, but it's important to have the skilled people to be able to operate them should that be needed. So in order to do that, because country and people, not only in Delhi, but even in the regional referral hospitals as well, where we think the critical care capacity should be built further.
Yeah, that's my question. We have now, how many equipment we have? How many ventilators? How many? There's a lot of, and there are people, all situations are very bad situation. We have equipment now to bring this. You have?
Absolutely. I mean, be assured the country is a huge number for a country of the size of Timor. There are hundreds of oxygen concentrators that are available in the country. There are a number of critical care equipment that is available, from what we call as the infusion pumps, when we call it as the patient monitoring.